All right, good evening, everyone. Welcome to Gay Men's Health Crisis. We're really pleased to be hosting tonight's forum on HIV prevention with gay and bisexual men. What does that mean? You can't hear me? How about now? So I'm Sean Cahill. I'm the Managing Director for Public Policy Research and Community Health here at Gay Men's Health Crisis, and it's really great to see you all here. Thanks for coming out. Before I introduce the panelists, I'd like to briefly frame tonight's conversation. As most of you know, HIV is not a gay disease, but it continues to disproportionately affect gay men, both here in the US and around the world. Of the roughly 56,000 new infections which occur every year in the US, about 30,000 of them occur among gay and bisexual men, and other men who have sex with men, however they identify. And while gay men of all races are affected, black gay men bear a disproportionate burden in the epidemic. Last year, GMHC developed an analysis based on our 30 years of work doing prevention with gay men. And we made a number of recommendations aimed at the Center for Disease Control and our state and local governmental partners and how to do HIV prevention differently with gay men. And I would encourage you to grab a copy. There's copies on the table outside the room, as well as a lot of other prevention materials. It's also on our website at gmhc.org. And there's a bunch of other things out there. We did a report on older adults in HIV, both in terms of prevention and care. And we have a magazine. We published 2 magazines, and copies of one of them are outside as well. So we're here tonight to discuss how best to conduct HIV prevention campaigns with gay men. And over the past few months, we've seen a number of campaigns here in New York City, which is a wonderful thing. In October, GMAC ran its I Love My Boo campaign on the New York City subways. It's the first time we were on the subways since the 1990s, at least, thanks to a generous grant we got from Senator Tom DeWayne. And in December and January, the New York City Health Department ran a TV ad. It's not just HIV campaign. Ran this ad on local TV stations, and a version is now running on the New York City subway. As far as I know, this ad, which targets gay men, is the first TV ad we've seen about HIV in the last decade, since I moved here from Boston 10 years ago. And also, I just noticed the National Institutes of Drug Abuse is running an ad on New York television targeting women, and it's basically an ad that's aimed at drug use, saying, if you use certain drugs, it can put you at risk for HIV. You can, get too high and not know what's happening, and you can put yourself at risk. And over the past year, we've had also the HIV Starts With Me campaign, which was just relaunched, and a national campaign called Greater Than AIDS. So tonight, we'd like to discuss, how we do prevention with gay and bisexual men in particular. What are the most effective ways to use social marketing, to use social media, to reach this population and to promote safer sex and to reduce HIV infection. So we look forward to a vigorous, passionate, and respectful conversation. We all share the same goal, I think. We sometimes disagree on how best to reach that goal of preventing HIV. So joining us tonight are Oriol Gutierrez, who is second from left here. And Oriol is deputy editor of Pause magazine and editor-in-chief of Salud, Your Health. Also joining us is Daniel Rodriguez, who's first to my left here, program coordinator at the Black Men's Initiative at Harlem United. We also have Dr. Blaine Cutler, third to my left, who is the director of HIV prevention at the Department of Health and Mental Hygiene here in New York City. And Dr. Cutler is an infectious disease physician. Next, we have Daniel Siconolfi, who is the project director at the Center for Health, Identity, Behavior, and Prevention Studies at New York University's Steinhardt School. And then finally, all the way down the end of the table is Les Pappas, who is the president and creative director of Better World Advertising. So we're really grateful to you all for being here tonight. And we're going to be joined by Dr. Monica Sweeney, who is the assistant commissioner for HIV, who's going to arrive a little bit late tonight. So Dr. Cutler is going to speak on the panel, And then during the Q&A, Dr. Sweeney will hopefully be here and be able to answer some questions. And we also hope to be joined soon by Tokes Osubu, who is the Executive Director of Gay Men of African Descent. So the format for tonight is that each panelist is going to provide brief remarks, and then we're going to hear questions or brief comments from community members. We're filming this forum, and we're going to post it on our website and on YouTube. And so if you wish not to be filmed, the no filming zone is in the far back of the room, where the gentleman with the hat is sitting. And I really want to thank Krishna Stone, who is our Assistant Director of Communications and Community Relations. This forum was really Krishna's idea, and Krishna really did all the organizing and really drove it, and has been a real leader, just in engaging, having this really important conversation as a community. So before we start, I just want to ask my colleague from the GMHC Policy Department, Robert Valadez, to read the rules of respectful engagement. We adapted these from the Rhino White Planning Council.
Hello, everyone. So we are prepared tonight to have a really interesting, dynamic conversation about prevention issues. And so as we move forward with that, we want to be really mindful of the rules that I think you all have in front of you right now. But I'm just going to read through them very briefly. Please be honest and specific. Focus on content rather than personalities. State your views and allow others to state theirs. Treat everyone with respect. It's kind of a no-brainer. Wait to speak until recognized. Try to identify practical solutions as well as problems. Recognize that the facilitator may have to limit discussion to the agenda, so we might need to apply the 1-minute rule to limit the length of comments. Disagree without being disagreeable. Keep an open mind and make a decision only after information has been presented and discussed. If you are unsure about what someone said, respectfully ask them directly. If you're upset, take some time to calm down before engaging in further public discussion. And follow and help enforce these ground rules, please.
Okay, thank you. So we're going to start off with Oriol Gutierrez from Paz Magazine and Salud. And I don't know, Oriol, if you want to come up to the rostrum or if you want to just stay where you are.
I'm pretty comfy here. Can folks hear me? Do I need to use this?
Yes.
Yes.
I think you need to use it.
Because we're taping.
Okay, Krishna. Hi, everybody. So I'm the deputy editor at Paz Magazine. It's Oriol Gutierrez, Oriol Bird, not like a cookie. Thank you, someone mine. So where do I begin? I was diagnosed in 1992 with HIV, but I'm sure that I served already in 1981. So this is my 20th anniversary this year living with the virus. Not something to be too happy about, except for the fact that I'm really happy I'm still here to say that I've been here for 20 years. I don't know that 20 years ago, when I seroconverted, that a scary ad would have stopped me from doing the things that I did to become positive. That said, obviously, I'm not really a big fan of scare tactics. To follow the questions here that were laid out on the flyer, what are effective HIV prevention messages? I'm a big believer in honesty. I think we should be honest. There's no point in not being honest. I don't object to the actual things that are being said in tactics that scare people. What I personally object to are the manner in which they're presented. I think that you can be honest without scaring the crap out of people. I also think that it's much more easily digested to just say to folks, this is what you have to gain if you do X, Y, and Z, versus, if you don't do that, this is what you have to lose. And we can debate studies and stuff, and I'm certainly not the most learned on those, but there are definitely studies that show that that is a much more advantageous way to talk to people. So do scare tactics work? A very simple question here, and the answer to me is yes and no. I have a blog at paz.com, and I wrote about this subject, and this is why I'm sure I was invited here tonight. It depends on what your objectives are. I mean, if you're talking about a short-term gain, scaring people can make people do a lot of stuff. If I put a gun to your head, and you tell me to give me your money, give you my money, I'll probably do it because I'm scared, right? So scare tactics work in that sense. But as long-term motivation, over time, I'm just going to stop listening to you. Some of you probably stop listening to me right now. So there is something to be said for not scaring people over the long term, and I don't personally think it works, and I don't personally think the studies show that it does. Young gay men, I was a young gay man at one point, I was scared of HIV, and I don't think that's different now. I don't think that anyone could say that people aren't already afraid of becoming positive. So I don't think that scaring them even more actually will ever make them feel as if they were living in the 1980s and every friend they knew was dying every moment. If that's the objective, I don't think we're ever going to actually recreate that kind of fear. So if we're not going to recreate that kind of fear that actually motivated people to do some really courageous things back then, in my opinion, all you're really doing is just furthering stigma of HIV positive people. And I would just punctuate this a little bit with, to my left, sorry, you're probably going to hear a lot of this tonight. My one big bone to pick, besides just the tone and the manner in which the messages were presented, my biggest bone to pick is the depiction of the anal cancer. I was not a fan, and I didn't really like the tone, but that kind of was the straw that broke the camel's back for me. I think it was unnecessary, and I think it took the conversation, those 3 seconds, or 2 seconds, or the 1 second that it was on the screen, literally took the whole, it sucked out the air from the message, in my opinion. And now all I'm thinking about is that Frankenstein ass. And quite frankly, that is all I was left with, was just this message of a Frankenstein ass. And honestly, I think that just takes us to another conversation. So now I'm thinking about if I have sex with another man, my rear end might end up that way. I am now afraid of the anal sex. I am now afraid of my own sexuality. Are those the messages that we really want to be conveying to people? I would just return real quickly to my first comments. It's short term versus long term, and if the idea is to scare people in the short term to bring down rates in the next year or 6 months, maybe that might work. I'm not even convinced that it would. But over the long term, I just don't see that being the long-term solution. I don't know that we would equate penile cancer or vaginal cancer and show a diseased vagina or a diseased penis in that way. I don't think we would, and I don't see a reason why we did that for an anus. So maybe on the word anus, who's next?
I just want to ask a question.